Okay, guys, let's start with the fact that today is January 3rd, 2011. And Melody, you're back from the ketamine coma about 5 months ago.
That's right.
It should be noted that I saw you about approximately 5 weeks after the ketamine coma, okay? And so let's talk about a little bit what's happened in the interim here. You've had one infusion with Dr. Cantu, I think it was for 4 days in the hospital. 5 days?
5 days.
5 days, right. And each day we're getting a 4-hour infusion with a little trickling down of ketamine in the interim.
Right.
Anyway, it helped you. That's what's important. It helped you. And that was a few weeks ago, correct?
Right.
Okay. Other than that, your life's been pretty good, okay? And as a matter of fact, we just did your pain thresholds just a little while ago as an objective measurement of how you're doing, and your pain thresholds have actually improved since I evaluated 5 weeks post-coma.
That's encouraging.
Well, it is, and that's why we do this, because we want you to be encouraged. Now, and what we want to do now, is, which is really important, we want to go through your exercise maneuvers, okay? Do the vertical finger test, okay? Put 2 vertical fingers in your mouth. Having any pain when you do that? Okay, there's no change there. Now, take your right hand behind your head. Having any pain when you do that, when you sit straight?
No.
Okay, now do your left, which is your worst side. How about that? Any
Just
pain?
a little.
Little bit? So you're maintaining the improvement there. But pre-coma, you couldn't really get your hand back there.
Right.
Okay. Next, we're going to kind of move our attention down to your feet. I want you to... Oh, I'm sorry. I apologize. Your right hand out in front of you. Open and close as fast as you can. Good, good, good. Left hand, same thing. Very good. Excellent job. Okay. And that's similar to what we saw last time when you were here. Okay, right ankle out there. Rotate your ankle. Wiggle your toes. Good, good, good. And hitchhike back to Delaware. Okay, there you go. Okay, the other side, do the same thing. Rotate. That's your worst side. Wiggle your toes. And hitchhike back to Delaware. Very good. Okay, now I want you to get up there in front of the door, please. Okay. And we're going to ask you to take 3 steps toward me, please. Atta girl. 3 steps back, please. Okay. All right. Now, are you having any pain when you did that? Okay, good. Now we're going to challenge you a little bit. If you need your husband to stand by your side, that's okay with me. Okay. All right. So I want you to take 3 steps forward on your toes, please. Get up on your toes. Atta girl. Go on back. Okay. Good, good, good. And did you have any pain when you did that?
Just a little in my left.
Right.
My left.
Obviously, much greater, much improved since the ketamine coma, correct? Okay, heel time. 3 steps on your heels, please. Go on back. Okay, good, good, good. All right. And you can go ahead and sit down. Okay. Now, we always try to use these post-coma videos for educational purposes, okay?
Okay.
So, and I'm not trying to put you on the spot. I know you're smart, so here we go. All right. People that go through the ketamine coma, what are the 2 most common reasons why they relapse?
Re-injury and stress.
And stress, right. And by far, re-injury is the big thing. And you know that the heated pull exercises are very important because it's one exercise you can do which is least likely to re-injure yourself, right? Okay. And now with regards to stress, that's a little bit more of a, how would you say, a little bit more challenging to understand. And your husband here, he's a minister, and I know he has to deal with his parishioners. I couldn't quite get that word out. I couldn't get the word out. And so, why don't you tell me what do we know about stress, and what do the clinical psychologists try to do in order to minimize stress in these patients with based on your experience as a minister?
Well, my experience as a minister is a little bit limited in terms of working with clinical psychologists. Melody's clinical psychologist tried to get her to do some breathing exercises, muscle relaxation, things like that.
And why? Why that? Why not just,
to get her to focus on the now? And that's where my experience as a minister does come in. People who are consumed with stress and anxiety tend to let the future spin out of control in front of them. And so if you can focus on the now, and versus the pastor, I encourage them to recognize that God is there, can help them and encourage them in that, and trusting in Him and to follow Him, and things will work out. That's the direction I point people to. But these ways of trying to get people to zero in on what's happening now and not just let their mind spin out of control, it's important.
So as an if I can use the phrase, as an alternative to God, okay, G-O-D.
well, they're all their
As an
alternatives.
alternative to God, we can talk about breathing exercises which bring you to the now, right?
Yeah.
And the progressive muscle relaxation techniques which bring you to the now instead of catastrophizing the future, okay?
Yeah.
And that's where we see real problems coming up. So there's more to life than just God. That's what I'm saying, okay? You got other ways of dealing with these stressors.
Yeah. Well, life comes from God. I would never encourage somebody to view life as an alternative to God. But yes, I would say this, that
I'm listening.
Because God has given us knowledge, and science is organizing and using that knowledge, technology actually using the knowledge, then we can focus ourselves. Yes.
Very good. Excellent. Good. So thanks for for getting us into that discussion, because I think stress management is an extremely important part of rehabilitating patients with CRPS. And my understanding here with you, Melody, is you're seeing a clinical psychologist and you're going to explore some of these modalities. That's my understanding. Mm-hmm. Excellent. Very good. Now, is there anything in addition you think we should be discussing at this point in time that you think is important to share with others?
Yes, distinguishing between good pain and bad pain. Can you kind of give me a little brief synopsis of, on a daily basis, how do I distinguish between good pain and bad pain?
Yeah, well, first of all, CRPS patients tend to learn how to distinguish between acute pain from an injury, as opposed to their CRPS pain. It's a different sensation, different experience. So that's one thing you can sort out. When you talk about good and bad, I think what you're trying to say is, when do I know I have a pain that's going to lead to something more permanent? Okay,
right.
I think that's your concern.
Exactly.
And you know what? That's almost impossible. Almost impossible, with one exception, and that is we talked about having good hangovers after a good workout in the pool, as opposed to a bad hangover. Okay, where you're laid out in bed for 3-4 days.
Right.
And that's, you got to learn how to gauge yourself. Okay.
I think what happens with me is I don't get laid out in bed after a good workout in the pool if I have something happen that feels sort of RSD-ish, I'll put it that way.
Right.
But I'll kind of feel, I might have a little limp, or my arms feel a little weaker or not as good as they did before.
Right.
But I kind of seem to bounce back a little from it, but not quite all the way back to right immediately post-coma.
Right. Yeah, well, again, I'm going to get back to what I said. It's hard for you to know what the prognosis is on every itch you have and every pain experience you have, okay?
Right.
All right. Now, on the other hand, I think it's important not to, as we discussed earlier, to catastrophize over those possibilities.
Right.
I think also I would strongly recommend a way to deal with that in an effective manner is to do what we're doing right now. In other words, record in an objective manner your progress. We went through your exercises, and you couldn't put your left hand behind your head when we started you,
Right.
before the ketamine coma. You can do a lot more things now than you could ever dream of before when you had the ketamine coma. So what I'm saying is, maybe every 2 or 3 months, take a video. Do these exercises.
That's a good idea.
So when you get one of these bumps in the road or pain experiences, you say, hey, wait a minute now, I'm not going back to where I was, and here's the evidence. I have it right here documented. I think that's one of the ways in which patients find that they can keep them on an even keel, is always going back and reminiscing and having some record, like a video, that demonstrates that they have made a significant improvement.
Can you get those, do you need a prescription, or can you use one of those pain measurement tools that you use here?
That's difficult. That's difficult because it's about not only just applying the force, but you got to do it at a certain rate, and that takes a little bit of skill. Okay, so but I think the videos will do just as good a job for you. Okay, just running through this basic.
I think that's probably good for the caretaker too, because caretakers can get discouraged if you feel like you're making a regression or something.
Yeah. Well, that's true, and it does help for them to see the progress. Okay, so you can't live in a bubble. You're going to have things that happen along the way, bumps in the road, and you got to keep your eye focused on where you were and where you're going, and have some documentation along the way.
While focusing on the now.
Exactly. And it can be fun. It can really be a very enjoyable experience, like a vacation for the mind.